Hello, it's Dr. Mike here again, board certified chiropractic neurologist. Here to present another case study with some more neurological findings and how we address those neurological findings and actually change those. Let's get along with it. If this is your first time to the page, please like and subscribe down below and share with all your friends, any neuro friends and neuro mates that really love this stuff. Let's get along with the case. This one, female patient presents with issues with motion. She said about 3 weeks ago she was on a boat, and afterwards she felt like she was on a boat for 3 days. And she says ever since then, when she's driving her car, whenever she comes up to a stop sign or stops, she feels like she's still going. She states when she's walking through the halls or in a room, she feels like the walls are moving with her as she's walking. Let's see. She states when she was playing cards the other night, the motion of her dealing the cards also gave her an feeling of motion, and flickering lights also give her a little bit of motion. Cool, so there's her presentation. Obviously, whenever she came in, we already had imaging had been done. She was clear of all that stuff. Nothing serious was going on. We checked her vitals. All that was good. So now we move into more of neurological function and how it's working and what we're going to try to do to change some of it if we can, right? So what we do now is, once again, we put her in these VOG goggles that have a room view so I can see what we're doing with her. You can also see what I'm doing to her. It's really nice. Remove fixation. She's in complete darkness and we can see her eyes and see how they're moving. And we go to check out her vestibulo-ocular system and see how it's working really well. What we found with her is whenever she looks to the left in the goggles in darkness, she gets this feeling of nausea, like she's going to throw up. Whenever she looks to the right, she has gaze-evoked nystagmus, so when she's looking to the right, her eyes are drifting back to the center, has a centripetal drift, and it looks kind of like that. Gaze-evoked nystagmus when she looks to the right with her eyes. Then we did some head movement stuff. The first one that really created a symptom for her is whenever we tilt her head back like this, and held it back there for a few seconds, and when we came back straight, her eyes were actually, they had an upbeat nystagmus. So she developed an upbeat nystagmus after holding her head in posterior pitch for about 10 seconds. The second one that kind of got to her is that when we came down, like when we did anterior pitch holding and we came back up straight, she developed a little bit of nausea as well. So I take these objective findings and I take these subjective findings as they mean something, okay? So that's what she presented with. Let's start addressing and changing some of these neurological findings that we had. The first one I went to address was the right gaze-evoked nystagmus. So all I had her do was, with her eyes closed, I had her look to the right and hold her eyes over there for about 10 seconds, come back straight, rest for about 10 to 20 seconds. Then I had her look to the right again for 10 seconds, come back straight, rest. We did like 4 or 5 rounds of this, and that neurological finding improved. She no longer had the centripetal drifting after looking to the right with her eyes. Her eyes were able to hold to the right and held very steady without drifting to the center. So now I was like, cool, let's check to see what happened with the left gaze. So now I had her look to the left and for 10 seconds and come back straight, and she said she didn't have any symptoms of nausea, which is, for me, that's awesome, because it's awesome to change the objective finding, but then also make an impact on the subjective finding as well, because that has more to do with the patient than our objective findings. So I was like, cool, we know what's going to make her feel better with that. Now let's move on to the other finding that we had, which is when she tilted her head back, she developed an upbeat nystagmus. So typically with that, what I do is I have her hold like a double chin position. Some people would call it like a J-neck. I had her hold a J-neck and I gave her some resistance like this. So we're activating the anterior muscles of the neck, holding it like that. We held that for about 10 seconds, rest. We did 3 rounds of that, and then I had her go down like this and come back up. She didn't develop any nausea, which I'm like, that's awesome. Second thing I had her do was hold her head back for 10 seconds, come back straight. She didn't develop an upbeat nystagmus. So for me, that was a win. We stopped her objective findings of the nystagmuses. Then 2, we also stopped her nausea feeling. I had her get up and walk around. She didn't have any feeling of motion. The walls weren't following her. She didn't have any signs of that. So that is what we did. Now let's kind of talk through the why we did it. Once again, we're talking mainly about the vestibular ocular reflex and the vestibular system and how it portrays with the neck, the inner ear, and the eyes, okay? So with her, the first one we addressed is when she looked to the right, she had gaze-evoked nystagmus. So she has an issue with her eyes looking to the right. So what we do is, if it gaze-evoked nystagmus, I deem that as like it's a little weak looking to the right, okay? So there's 3 different options we can work with. Remember, it's our eye position to the right. It's our neck that turns our neck to the left. So anything that turns our neck to the left, any muscle that turns our neck to the left, we could use to improve her ability to hold her eyes to the right. We can also use her left vestibular system, because her left vestibular system gets activated when we turn our head to the left, which makes our eyes go to the right. So now we have 3 different guys that we had the potential to work with, and it just so happens that what we used was we just used the eyes holding to the right, and that seemed to get rid of or make that gaze-evoked nystagmus to the right a little bit better. All we did was exercise that a little bit, and that guy went away. So we were super stoked about that. So the next one we tried to get rid of was when she tilted her head back and developed a upbeat nystagmus, okay? So whenever we're looking at that, that tells me that the posterior neck muscles they have an increased rate of firing, and they're overly pushing the eyes down, right? So with that, we're looking at the posterior neck. Neck has an increased firing. And when the posterior neck has an increased firing, that's going to make that whole cycle of the vestibulo-ocular reflex develop, right? So if the posterior neck tilts her head back, makes her eyes goes down, we're going to have issues with our eyes are going to be drifting down, which is what she developed. Her eyes are going to probably be weaker looking up, and her front of her neck muscles are going to be kind of shut off, because if you're overusing a back muscle, the front ones are going to be underused. You know, it's an antagonistic thing. It's kind of like if I only work out my bicep here, my tricep's going to get really, really weak, because those 2 are antagonist muscles. When one fires, the other must shut off. Okay, so that's the way we're looking at it. That's the way I'm looking at it. So the things that I'm thinking about is, hey, in order to decrease the firing of the neck muscles in the back, there's 3 different things we can do. We can increase firing of the anterior neck. So we can increase the firing of the anterior neck by doing simple isometric contractions of the neck, which is what we ended up doing with her. That worked very, very well for her. The second thing we can do is we can use the anterior canals of the vestibular system. So we can increase the firing of the anterior canals of the vestibular system, because those have to do with the front of the neck muscles, and they also would cancel out the posterior canals. So whenever we're looking at the back of the neck firing too much, we have those are related with the posterior canals because the back of our neck tilts our head back, and we know when we tilt our head back, we're activating the posterior canals of the vestibular system. It also has to do with our eyes going down, okay? So to counteract that, we can do isometrics with the front of the neck, or increase the rate of firing the front of the neck muscles. We can increase the firing of the anterior canals of the vestibular system by just having them do anterior pitches like this, tilting the head forward. Another thing we can do is we could also have her look up. We could do up gaze holding. So those are 3 options that we could have done. The one that seemed to work the best for her is anterior pitch holding and isometric contractions of the front of the neck muscles. And once again, we just do these for about 10 seconds, like a little bit of an exercise. We let them rest for 20 to 30 seconds. We do another round, let them rest, do another round. And then we recheck the findings. So the upbeat nystagmus, whenever you're looking at an upbeat nystagmus, right, we're looking at the back of the neck, right? We're looking at the eyes down, and we're looking at the posterior canals. So those 3 all work together, and they're all 3 at that moment, they're kind of overworking, all right? We need to work the antagonistic side or the exact opposite side to make a difference. So we're looking at the front of the neck muscles we need to work. We need to work eyes going up, and we need to work the anterior canals, which would be just tilting the head into an anterior pitch position or forward down like that. Cool. So that's those were her neurological findings. This is the why I did what I did, and we changed her findings, her objective findings, and her subjective findings of the nausea and the motion issues. I really hope this helps somebody. If you think it'll help somebody, please share it with them. And once again, subscribe to this. We're going to be doing cases like this all the time. I'm going to have more information down below about chiropractic neurologists and information about that. Please subscribe once again, and Dr. Mike out.